I have some huge issues with people thinking public health is substandard care. And I think that it's really important that people know that, like any office you go to, any other situation like that, I don't believe that the treatment that we give people is substandard. We do everything we can. There's a lot of investment that goes into this, and I would want students to know that even when you're in private practice, you choose how you're going to treat your patients. And I think it has to do with a lot of the life experiences that I've had, that I do everything I can for this patient when they're in my chair, because I might not see them again.
We are not disrupting the industry. We are thinking outside of the box. Like the school says, no child left behind. We don't want any dental guests left behind. We want to be available.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists. I feel like I say that really fast now. Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 301. My name is Andrew.
Whoop, whoop. 301. Didn't we have such a great 300th episode?
It was amazing. It was so nice to have everyone on there,
So
like
fun.
celebrating with us and
So
doing all
fun.
the stuff.
Yeah, this is great. I'm really, well, you and I are recording right before we go jump on a plane to head to ADA.
Mm-hmm.
And I have such mixed feelings again. You remember me talking about this on my last one?
I
like
remember
going
after
to ADA,
every
RDH.
conference we talk about
I'm like,
this.
I don't know if I want to do this.
Yeah.
But I am actually, like, I set up some meetings and stuff like that. And I was like, oh, this is going to feel good. Get out there and network and see faces, remind people of my face. You know, it's that's going to be good.
Yeah, I'm looking forward to it as well. You know what? I had this thought, though, this morning, and I wanted to try and take a poll in, like, maybe some sort of a forum where there's a bunch of entrepreneurs, because I think I have, and I'm not really going to follow through with this, just so that we're all clear about my intentions here. I would like to know, though, how many different types of business cards do you have, and how many old business card boxes do you have from previous, like, starts or title changes? Or I feel like I have 5 boxes of business cards.
You're keeping the old ones?
Well, see, that's the thing. I do keep them, but that's more of a just laziness kind of a thing. There's no rhyme or reason to it, but, like, maybe I should just get rid of them.
Well, I mean, I think that would be a great fun poll just to see what everybody, you know, has to say. And even not just entrepreneurs, because I know a lot of hygienists are getting cards for their bit, like in the office. I know that's a thing. So it's funny that you bring that up. I told you a quick little story about my mom going to, like, my old family dentist, and the new hygienist there I don't even know how they got on the topic of infection control, or I guess they gave her a card of, like, these are our COVID precautions, which I was like, nice job, good job, Dr. Decker's office. So they gave her that, and she was like, you know, I don't even, maybe you could, I don't know if you always actually know what I do for a living, like all the different things. Like, could you actually explain all the things? You think? Yeah. I think you'd get it pretty darn close.
Maybe.
But there's very few. I'd say I could count on one hand the people who, like, if somebody's like, what does Michelle actually do? They'd be able to break down all the different things that I do in a day or in a week or whatever. My mom is not one of those people. She was like, it's some infectious disease. And she's talking about Level Up, infection prevention that I have with India. And then she proceeds to give my very old Tepe card, like the original Tepe card to them. It was like, the cell phone still works. I was like, thanks, Mom, for helping me network.
Good job, Brenda.
I'm going to get you some updated cards for the random moments that you have to give them out. But I probably have 6 sitting in my bag right now, ready to go.
That sounds about right.
And I I at one time tried to put all of them on one card, like having the different logos on the back and having like one almost like landing page, and you could like contact me. So the problem with that is that I left one or two of those companies. So then like what? Now the whole card gets like, I'm not going to permanent marker X over.
Right.
I don't know. It's a conundrum and it feels wasteful.
How do you feel about those people that are trying to be hip and cool with the square cards or the ones that don't fit my wallet very well?
I will. Yeah, that's brilliant and annoying all at the same time.
Yeah, exactly.
Yeah, I like it. I like they're standing out. Even the plastic ones, like the thick plastic clear kind of ones, I like those too. But yeah, they do create an issue when you are trying to tuck them in a business card holder, for instance. But I am very into, and we're talking about getting this for the podcast, the digital cards. Like one, like just a little electronic, almost like transfer to somebody's phone. I think that's pretty cool. The downside to that would be somebody like myself who's collecting cards at a conference, and that's like my physical reminder that these are the people I need to now follow up with. That would be hard for me, but I'm sure there's a way to do it digitally, and I just need to figure it out.
Well, that's the frustration I have with all the digital stuff is just like, how do you integrate that into your workflow that you've been doing for 10 years of networking and marketing, or how long you've been doing it? But
I had something this morning. Well, I was listening this morning to Dax Shepard's podcast, Armchair Expert.
Who we don't have beef with. Just we like them.
Andrew's not causing beef with anybody. It's so rare that Andrew has beef with anybody. It's usually me.
I'm trying so hard to like get these other podcasts to engage with us, and like they're big timing us. And I'm like, who do you think you are, Dax Shepard? Like, come on. Monica Mouse, let's do this.
I mean, what did he sell for $80 million to Spotify? Yeah, we are a drop in the bucket to him. But they were interviewing David Sedaris, I think that's his last name. And they had a dental thing that they were talking about because David Sedaris had just gone to the dentist. He had gotten braces during the pandemic because he wasn't on tour and he was wearing a mask. So he's like, this is the time to do it, which I think is so smart. And I'm pretty sure, I'm like 99.9% sure that they were talking about the intraoral scanners and maybe doing like an iTero or whatever the 3D scanners are. And they just had this like rant about like, won't there be a day when you look back on this and you're like, this is so stupid, I had to put that in your mouth. Like, and I was like, buddy, do you remember Alginate? Sir, this is the progression. Yeah. Welcome.
Yeah.
If your office has an intraoral scanner that they're doing on a regular basis, like welcome to a progressive dental office.
Yeah, that's a good one for sure.
I just found that hilarious. And then they talked about how horrible x-rays are. And I was like, ugh.
It's
story of our lives.
Like here we are thinking like, oh yeah, we switched over to digital imaging. So this is so amazing. And for a lot of our offices, it was 10 years ago, right? So then they're all just now talking about this. It's, okay.
Yeah. I know. I thought it was hilarious, but so that I guess is my little segue into if you do have an intraoral scanner, you're probably not working in public health.
Good.
Can we say that safely?
Good.
I feel real positive that you're probably not working in a public health office, or you are a unicorn, and I want to know where you are because I'd love to come work with you. But today our interview is for the students. But also, I mean, we always like to say this is for anybody who wants to listen. But we really talked about the difference between public health and private practice. And who should you go into public health right out of school? Is it better to go get some private practice experience? Like what kind of people want to go into private practice versus public health? Like what's the temperament and personality type? So it was a really great episode, and I think everyone will like this with Crystal and Janet.
Hey everyone, before we get into the roundtable, I need to give a quick plug for Q Optics. I cannot believe it has been more than a year since Chicago Midwinter of 2020. I remember clearly the day at the conference when we stopped by the Q Optics booth to get measured for loops, And beyond the high quality of their products, I was impressed by their professionalism. If you are a student listening to this podcast or a faculty member looking to help out your students, reach out to our friends over at Q Optics and get them into your program. You have heard on our show many times, we fully support using loupes during clinical care and highly recommend investing in a light as well. You'll be happy with that choice. To find out more and see what else they have in store, check out qoptics.com. That's q-optics.com. And now, back to the show.
Welcome, listeners, to the student portion, our student-focused interview for this this episode. I'm really excited about this conversation because public health is something that is truly after my heart, and I often wonder if I would have thrived in public health when I graduated hygiene school, or if I needed to have that private practice life. And so I have two guests on that. We're going to have that conversation. Like, what would it look like to graduate and go into public health, or what's your next step? So welcome to the podcast, Crystal Spring and Janet Crosswhite. Thank you so much for coming.
Thanks for having us.
Thank you for having.
So, Crystal, go ahead and tell us a little bit about who you are and what you're doing.
Hi, I'm Crystal Spring, and I'm a registered dental hygienist. I've been in clinical dental hygiene for about 23 years. That's a really, really long time. And about 10 years ago, I started in public health, and now I'm 100% public health. And I've worked in nursing homes. I started my own little mobile business, and then I got together with another hygienist and we created a nonprofit called Smiles Across Montana, where we are in nursing homes, school-based clinics, community centers, you name it. In public health, we're there.
That's amazing. I know. Congrats. And we also have Janet. Janet, welcome to the podcast.
Hello. Thank you for having me.
No, we're excited to have you. Tell us about who you are and what you're doing.
I am a dental hygienist here in Las Vegas, Nevada. I am the owner and founder of Heavenly Smiles Mobile Dental. We are a public health program here in Las Vegas, Nevada, and we are bridging the gap between those in underserved areas and the barriers that prevent them from obtaining access to oral health care. I started Heavenly Smiles this year, February 2021, and we have a mobile dental van where we bring access to care to our most vulnerable population, our seniors and our children.
Mm-hmm. So let's talk about like our verses. We have private practice versus public health, and we can all say that private practice is not one big bucket. You know, there's different types of private practice, DSOs, perio, general, pedo, and we can say the same also for public health, right? There's FQHCs, there's mobile, there's community health centers. You could own your own public health van or practice, I guess I should say. So let's talk about like what do you see the differences are between public health and private practice?
So as far as some of the differences, I kind of want to bring in like how I think of things, because I have some huge issues with people thinking public health is substandard care. And I think that it's really important that people know that, like any office you go to, any other situation like that, I don't believe that the treatment that we give people is substandard. We do everything we can. There's a lot of investment that goes into this. And I would want students to know that even when you're in private practice, you choose how you're going to treat your patients, the kind of care that you're going to give them, what you're going to stand for. So that's really important. And I really just wanted to put that out there, because that's always just hurts my feelings a little bit sometimes. I'm like, no, we are giving good care to all of our patients. We talk about the oral systemic link. We talk about different things that they can be using for home care. I think that really needs to be said. But then again, I don't get to work on beautiful aesthetic cases that you do in a private practice office. So there's a place for everything. And I think that, of course, there's some pretty big differences, but I just want students to know that if your heart is for public health, you will miss out on some skills or some experiences. But I think that I don't want it to get in the way, that type of thinking that it's substandard care and you won't be treating your patients as well.
And just to piggyback on that real quick, I think that can also be said about private practice, because I went into perio. I did not do restorative care. I didn't even see a filling placed or a crown prepped until like the last few years of my career. And the opposite of that is saw implants every day, all day. And a lot of my restorative counterparts had never worked on an implant. They didn't even know how to interact with an implant. So I think that is so true. And I love that you said that about it's not substandard care. We know the standard of care is a moving bar. And, some of the standard of care might be dental implants for those people. And the standard of care, I think, could be like just getting them healthy so they have a dentition to, chew with, and that's totally acceptable. It's about like just not offering like less than just because you're in a public health situation.
I totally agree. I could not even agree more. And the fact that, and I'm going to repeat that, we do not provide substantial care. We actually go, in my opinion, sometimes a little bit above and beyond. Just as an example, we all know that most patients are not regular, quote unquote, cleanings. And so when we're out there, for me, I've been doing a lot of scaling and root planing, but haven't been able to build for that. So we don't go out in the public looking to make a killing on those who need the access to care. More, I'm not saying more than though in the traditional setting, but I find myself scaling for quote unquote hours, and my assistants are like giving me that look like, okay, we need to come back, but it's like, no, I have to get this right now. This is why we're here, but standard of care, like you said, is a moving bar. We go above and beyond. And this is why public health is not for the faint at heart. It's not for those who's just trying to make a quick dollar. It's really, you have to have a passion for it. And you will be blessed with financial blessings. You will get money because you're doing it. It's a business, one. So you're going to make money, but you're doing it from the heart. And so people need to really understand. And that's why this platform is designed, so that we can educate, and because we learn every day. Public health is definitely, I'm passionate. I'm sorry, I'm passionate. So
no, I think we all hear your passion and we hear your heart. And I think anybody who has worked in public health truly knows that we bust our butts to make sure that the patient gets everything. I don't want to continue to drive this point home, but I think it's just, as if I were walking into a private practice and we're going to do, maybe they had four cavities, 4 areas of decay, and we're going to fill that. Today we're going to do all 4. That's the bar at which we're going to have our standards for that day, and we're going to use all the right products. But then you might walk into a facility where you might have a person that struggles to sit in the chair for more than 10, 15 minutes. So you might only do 1, but that standard of care isn't less. You're right. Still doing all the right things. It's just different.
And I want to if we're driving home points, I want to drive home the point that the quality of care that you give, that is your choice.
Girl.
Where you work, that is your choice. There is no difference in the care that I give a patient when I was working in private practice and what I'm willing to do for them in public health. So I think that you can still be a top-notch hygienist in public health. And I think that sometimes we have a model that we see like, oh, I've heard this FQHC is really, they're really busy and you have to go this fast or whatnot. You can dictate how you treat your patients. You might not think you can, and you might need some confidence building to make sure you have the right instruments, the right tools, all those things. But you can create the job that you want, whether it's in public health or private practice.
So I want to ask you guys what your thoughts are around if someone can graduate and go into public health, or versus, like, I guess who would go into public health versus who would go into private practice? What are your thoughts around that versus, public health versus private practice out of graduation?
So for me, it really was when I did my externship, is what people like to call it. And I went into the nursing home. My cousin is a RN, and she ran a nursing home back home in Detroit, where I'm from, where I went to school. And when I went into that nursing facility, I just saw the need. I couldn't, to be honest, and I'm totally honest, I couldn't sleep after that. It was boards was coming up, and I just could not get out my mind how much their dentures, the fact that if they didn't have dentures, the amount of buildup that was in their mouth, I actually got to see my cousin use like a suction and have to aspirate her patient's back of the throat because it was just gobs of food just stuck there. And I said, how can we do that to our seniors? And I'll leave that to the geriatric tooth fairy and that arena, but I could not sleep when I went and did that. So in my mind, I knew that I needed to help in some kind of way. I didn't have all the answers. I didn't even know how I was going to be able to get back in there, but I knew that I needed to be out in the community. And I also think that because I worked in a dental office before becoming a hygienist and seeing the public that we serve, I think that also played a part because it was more of community-based, a community-based practice. We were, quote unquote, a Medicaid practice. And so I saw so many people in need of dental care. So I think when you're in school what you like I like perio too. That was basically all I did, my class 4s, in school. But I said perio or public health. And so I think that at a certain point in time, Crystal, how do you feel about that?
So my journey was a little different, but I mentor a few hygienists or hygiene students right now, and something, obviously I'm not trying to make the choices for them. Hygiene school is expensive for a lot of people. You're looking at things like loan repayment. Some of the things you end up really loving these students, and you really care about what their trajectory is going to be, where they're going to go. I always feel kind of conflicted because, you're an amazing public health dental hygienist, but I also want you to be able to have the experience of working in private practice. I don't want them to be without a lot of the experiences that you get in public health. I would say the perfect option would be to start out a couple days a week at a private practice and, work in public health also. But a lot of those choices aren't open if you need loan repayment. I know that some of the different government agencies, you have to you're either full-time and you can't work for anyone else. And so those are some hard choices. I think that things that students can be doing, if that is the road that they take, I think they can completely do it. But I think that something I would urge you to do is go to, your national meetings to learn more about procedures that are going on and things that you don't know about. Be listening to podcasts, stay engaged with the other side of dentistry. So you're not just in a situation, we talk about the standard of care we can give a patient, but also as hygienists, I loved the restorative part of working in private practice. And I think that's just something you kind of miss out on in public health because we're very limited financially. None of the offices that or groups that we work with are able to do implants for a lot of our patients. So that's just something we don't get to see. We don't get to do implant maintenance. We don't see that population. So I think it's really important to be looking at educating yourself if you have to go in full time to one thing or another. So,
but it's just
I
so
agree.
different, right? Like, sorry, Janet. I just thinking like it's so different. Like, I might learn so much about glass ionomer and SDF and true prevention when we're talking about those preventative products out there in public health. And I think that is so special. But I definitely learned a ton about perio and furcations and grafting and tissue and bone and everything when I was in perio. I don't think one is better than the other. I think they're just different paths. And what a dream it would be to have a little bit of everything. Like I've worked perio, I've worked restorative, and public health though is what lights me up from like the burnout isn't as great when I am doing what my driver is, and my driver is giving back and altruism, and it's not business driven. So I think just finding your drivers is another important thing because, yeah.
I have this really quick thing. I just want it, like, this is kind of my mantra. I'm like, once you go public health, you're not going back to private practice.
Yeah.
Like, so if you're going to work in private practice, like I know Janet's story, she said that she did, but there's always some hiccups. But once you're in public health, I dare you to try to go back. It's, I no longer can work in an office that doesn't take Medicaid because, that's where your heart is. You become pretty passionate, I guess. That's my word for crazy about public health. And it's really hard to leave that.
Yeah. And that's exactly what I was going to say, because I did start off in public health first, and I had to go into private practice, and because it like the finances is just at the beginning I couldn't make it, and so it was becoming stressful. But we also the company I was working with lost their grant money, so that's the thing that students may want to consider. What type of public health practice are they looking into getting to? Because if it's based on grants, then they will have to plan a certain kind of way versus like for Heavenly Smiles, we are a fee for service, but we aim on, I was so excited when I was able to get my Medicaid MPI and bill Medicaid reimbursement. Absolutely. And so it's like Crystal said, it's passion. So I speak from what I love, but she's right. When you get into public health, it's hard to go back to private practice. I don't ever see myself going back to private practice, but I do appreciate and I'm grateful for the experience that I obtained from working in private practice all these years, because I am able to, it's like Michelle said, one is not greater than the other. They're both great. Dentistry is amazing. I think we all can agree on that. But I think the experience is needed too. And that may be where people come and say, "Oh, you're giving substantial care because you just go in there zip zip zip." But if you have the experience of being and having time management in a clinic, a private practice, that helps with the public health setting.
And I'm curious if you guys have any thoughts on the kind of personality type that goes in or thrives in public health versus private practice.
Ooh.
I know who I am, and I know the type of hygienist I work well with. I think one of my counselors or therapists told me this. It's they called me intense. That's a really nice word, I guess, for completely crazy. So I think the type of person, so it is so important for me. And I think it has to do with a lot of the life experiences that I've had, that I do everything I can for this patient when they're in my chair, because I might not see them again. Mm-hmm. I think to work like that, you have to be obviously a very empathetic person and understand that, people aren't in this situation having to come to your public health clinic because they're lazy or they're less of a person. It's their situation in life, and you're meeting people where they are. So I think you have to be very empathetic. I think you have to be very committed to excellence too. That is what keeps me going. When you're working in an office, you might get out of school and the hygienist that you're working with isn't taking probe depths, but it is the right thing to do. So you take the probe depths, even if no one else is, and even if they hate you for it. So I do have to say that you have to have thick skin. You have to be the type of person who's committed to bringing just excellent care to all of your patients and loving those patients like your own family. So I would say you want to be empathetic, you want to be professional, and you want to be, I don't remember what the other word I said, but you want to take care of your patients like they're your own family.
Absolutely.
Janet, any thoughts? Yeah.
Absolutely. And for me, I always tell them I do better than I would with my family, depending on what family member I'm dealing with at that time. So I treat them based on how I want to be treated. And like Crystal said, they're not there by choice. Our patients are, a lot of our patients, we were just in a memory care on Friday, they cannot come out, so you take the situation at hand and you, like Crystal said, you meet them where they're at and you give them the best care. And for me, I try to go above and beyond. You definitely can't be a lazy hygienist. You cannot, no one on the team can be lazy in public health. So if you're thinking that, I can set my own hours, it's going to be smooth sailing. I'm sorry, this is not the position. Because it's not. I was up 3:00 this morning working on some things. So sometimes it's sleepless nights because if you're compassionate, in which you should be, sometimes you can't turn off the light bulb at that time that you should because you're thinking on the next adventure, the next opportunity to get to those
patients. And I would just add to that I think a hygienist, or a personality type, I should say, is somebody that can be real fluid, very mobile, very agile in your day-to-day activities, because I know your patients from day to day might drastically change. You might be in a Seal a Smile thing versus a long-term memory center or on a van. I would say somebody who is able to think outside of the box, that can kind of has that critical thinking skill set, and that's something that we have to be taught in a lot of cases. And I think somebody who goes to private practice is maybe they aren't feeling as confident when they graduate, and they need that structure right in the very beginning, so that people guide them, so that there is very definitive rules and processes and standard operating procedures, so that they walk into it, they get their footing, they get their foundation, they get their confidence, and then they become a little bit more agile. That's kind of where my brain is going. What do y'all think?
Yep. And I think that critical thinking piece is the most important, because you are going to be in all kinds of different scenarios, and you're going to have to think for yourself. You cannot rely on the dentist, another hygienist in the office. You might be all alone. And so the critical thinking piece is, I would by far say, the most important part of our work. You see a lot of people struggle if you need that direction. And I think that is where go get confident working in clinical practice, in an office, and then do public health if you're not ready, because confidence is important. You need to be confident to make these decisions without guidance or someone there with you all the time. You have to you need to know your stuff. So I want to go back really quick, and then I'll let Janet talk, and you can put this somewhere else. But when we're talking about that substandard care, so I've gotten a lot of comments over the years and heard a lot of things about hygienists working in nursing homes or hygienists working with people with disabilities. nobody is able to get everything on some of our patients. It is almost impossible. So you're hearing like, oh, wow, they come in and they don't even get everything. Well, you have to understand that we're not getting everything in clinical practice in an office either. We're doing what we can with the patient that we have in our chair.
That we have.
Yep.
And I had to recently deal with that because the patient couldn't sit, for a very long time. And so we were trying to get as much work as we could. And I was getting frustrated with myself because it was just some areas that I couldn't get to because the patient wasn't able to allow me to get there. And I said, I can't leave this here. I was just beating myself up thinking like we do in private practice, the doctor's going to come in and check and he's going to embarrass me. And it's just like, for me, it was like, oh, the caregivers are going to see it. And then they're going to say, well, she didn't get that off. And it's like, I always tell our patients, the caregivers, you just like you're doing the best you can, we're going to do the best we can. And if there is something that needs help, I'm going to bring it to your attention. So I'm glad you brought that back up, Crystal, because you're right. Sometimes we cannot get everything, but sometimes in the office, I haven't been able to get everything and had to do quote unquote fine scale in a week. And so people really shouldn't point the fingers and say that public health dental hygienists are providing substantial care. They shouldn't do that. That's not true. That's not accurate. And it kind of makes me sad if I'm new again back in public health. So I haven't had the pleasure, quote unquote, of hearing the negatives. So I thank you for bringing that up.
Yeah. I mean, I'll tell y'all right now, I leave calculus. If it is going to be the time, and that's private practice and public health. If I leave stain, I leave calculus. I aim for it to be super gingival calculus, so I can truly get under the tissue and get it nice and healthy. But I'm going to put my focus on biofilm and home care. I'm not even trying to kill my hand or make that patient tolerate any more than they already are. I'm aiming for biofilm management, home care, tailored instructions to engage them, because you know what happens is those tissues shrink back, there's less heme, and they come back, and then I can just knock that off with a piezo or a Cavitron or a quick hand scale, and they're healthier, I'm happier, less stressed, my hands feel better. We have set some real interesting standards as an industry about how we work. And so when we do miss, quote unquote, air quotes, like miss something, we are seen lesser than, and like, well, let's talk about what the alternative was. Do you want me to spend less time going over home care?
Right.
Like, let's talk about that.
So I always remember, I've been a dental hygienist for 23 years and I worked in perio, and I remember everyone talking about that glassy, smooth surface. I'm like, you mean the people who can't eat anymore because they can't stand hot or cold? Yeah, like crazy. Things are changing.
Things have changed.
Yes.
So as like a little final thought on this topic with our verses, what are some highs and lows of working in public health versus highs and lows of working in private practice?
So my highs and lows, I'll start with the low. The low is, for me right now, is being able to, in this pandemic, I know I cannot stand every time we talk about something that has to do with the pandemic, but it's the reality, okay? And the reality is people are not, they want the treatment. My phone is constantly ringing, but they're nervous. So right now my low is getting to, like, I want to do school-based. That was our plan, to do school-based for the underserved population. And The schools they haven't said no because of COVID. They're just saying, hold on a minute. While I'm out in the community and I see the amount of stuff on these babies' teeth, and I need to get to them. So it's getting the job done is my low right now. It's getting to the people. But the highs for me is that we are not disrupting the industry. We are thinking outside of the box, as Crystal said, as you said, Michelle, earlier. Like the school says, no child left behind. We don't want any dental guests left behind. We want to be available no matter what the circumstances are. We want them to obtain access to care. And we want to reduce the oral systemic link. We want to keep everyone healthy and we want to educate. We want to take away the barrier of the negative about dentistry. And so my high is that's my high in changing people's mindset, them understanding how important dental care is, and us being able to provide that in a non-traditional setting. So my high and low for my private practice experience would be the relationships with my patients and seeing, because it's family practice, seeing them on their recares and hearing about their vacations, because I love to vacation, and what their children are doing. They, them having grandkids or, kids going to college. So more of the family part. Also, the high in private practice for me is the schedule. I am one who likes to stick to a schedule. So having my, not per se like having an hour with a patient, but I know how my day is going to go. I can see my schedule ahead of time, and working in public health is all over the place. So you have to be, adjust. So that's my high in private practice, and the coworkers, just being able to talk to some people. Sometimes, I'm not able to talk as much as I was in private practice. My lows in private practice is not the team atmosphere all the time. It's always like cutthroat. You do your part, I'll do my part. Especially when working with other hygienists. And sometimes it's positive. A lot of times it's not so positive. You have a hygienist who wants it done, especially if they've been there longer, they want it done their way. And they don't have room for improvement or error or just adjustment. And so that's a low for me, because that brings stress. It's a lot of stress in private practice and dealing with the patients, doctors, coworkers. And so that's a low for me. I don't work well micromanaged or under stress.
So yeah, a huge high for me in private practice was being able to see my patients, full mouth reconstruction, like really seeing the whole picture. And I would say that's kind of a low in public health, because our patients can't always afford the types of treatments, to have the perfect aesthetic look, those kind of things. That's not always accessible. But a huge high for me in public health is that I wholeheartedly believe, and kind of my mantra is, everyone deserves a healthy smile. And I'm able to make health affordable for my patients. I'm able to be out there just daily seeing the difference I can make. Yes, you make a difference in private practice too, but there's this feeling in public health that you brought a service to someone who wouldn't have got it if you weren't in that job, if you weren't in that school, in that nursing home that day. That patient, most likely, almost 98% of the time, wouldn't have gotten the services that we provide. A low for me in private practice was that insurance tends to dictate some things. And if a lot of offices, I understand, it takes a lot to run an office, and offices can apply for grants and they can't take all the Medicaid patients. Like, I understand that portion of it. And that was what was kind of sad. I didn't blame my dentist for not being able to take it, but that's a hard part. And a low for me in public health is just sometimes how people don't understand what we're doing. Like we've talked about substandard care over and over again, or like a low is just being able to afford what we're doing. Janet and I both work mobily. And so then I also think too, I look at those working in FQHCs and with Indian Health Service and things like that. Their hands are tied by a lot of either bureaucracy or, big, like the head of the hospital saying that you can't see patients and things like that. So that's kind of a low in public health.
Yeah. And I would say for me, the highs and low, my high in public or private practice is my low in public health, and my high in public health is my low in private practice. My high in private practice is the amazing relationships you create with these patients. They're consistent. They're coming on a regular basis. If you are in like a more family practice, you're seeing everyone. That was a real high. I mean, I had some of my patients pay regularly, let that tongue tie say that for me, for my charitable dental mission trips. Like, they contributed to that. I had these beautiful relationships with them and they trusted me. And I don't get that in public health because I don't see those same patients so frequently. And the low of private practice is the nonsense of like patients being kind of, and I say this with like, I know that some things come from trauma. And so I'm not talking about these patients, but like, I don't want to like sit with the chair like that today. Can we rotate it so the sun isn't in my eyes? And I'm like, how about I just like slap you in the eyes and then you can't see? Like, I don't know. Like, I don't know. And then I have people that sit in my chair in public health that apologize for the tiniest things. And I'm like, no, like, I am so excited to have you in my chair. I'm so excited to offer this to you. I'm so excited to have these conversations with you. So like the lows in private practice are the nonsense crap that you have to put up with, where I feel people are very spoiled because they're very used to a very specific way of getting their health care. And then that high is being able to provide that high level of care to people who are apologizing for the tiniest little things. And I'm like just so excited to like give them all of me and all of my attention and all of my knowledge. It brings such joy to my heart. So those are my highs and lows. Well, I loved this conversation. I love that you both also have private practice and public health backgrounds so that you can speak from both sides of that coin. I think that if anybody is interested in pursuing the private practice or public health, like, just start asking questions and see what's available around you. Could they reach out to either one of you to chat about the differences or questions about public health?
Definitely. I think that's really important. You don't know if you're not asking questions, and every person's different. Every job situation's different. So, and a lot of these hygiene students have already worked in dental, so they have a pretty good idea of what's out there and what they want to do. I'm excited. I think the more public health hygienists we have, the better. It's definitely a growing field. For the first time ever, as far as I'm concerned, people are actually connecting their mouth to the rest of their body, and they're actually seeing that, oh, my neighbor's health does in fact affect my health. And so even people who don't have or don't use public health are still for public health in, right now where we are in our history. So
That's awesome. So what is some contact information for you guys? And we will have this in the show notes so that you can see it there. But if they are auditory people, what contact information how can they reach you guys?
So Heavenly Smiles Mobile Dental website is Heavenly Smiles Mobile Dental .com. And then my email address is Heavenly Smiles. It's a long one. Heavenly Smiles Mobile Dental @gmail.com. And we can be reached by phone as well, 702-445-1060. We're on Pacific Standard Time.
Awesome. Crystal?
Nice. You can look at our website, smilesacrossmontana.com. You can email me at smilesacrossmontana@gmail.com, or you can do crystalspringrdh@gmail. I'm on Facebook, Instagram, all the Instas, all the grams,
all the social things, right?
Yeah, all the stuff.
Awesome. Well, thank you both so very much for your insight and the conversation today. You guys are the best, and thank you for all you're doing in the world.
Thank you for having us.